Hi, everybody. I am Dr. Peikar, founder and inventor of Celebrace. Today, I want to tell you how you can submit a patient to Celebrace software to receive custom brackets and indirect bonding trays. So it's very straightforward. You go to hub.celebrace.com and you put your email and password and you click login. Here you go to new patients and you write the first name and last name of the patient. You choose the gender of the patient. Automatically, it chooses like the date of birth is 12 years earlier, but obviously you pick the right birth date and you choose what office this patient is going to be in. And then you have to, you could optionally upload the photo of the patient. Here I choose the frontal smile photo of the patient. Then I go to scan. I upload upper jaw, upper steel, and here you see how it looks. You can see like different angles. Then you upload the lower. So here you can see the lower. You can see like different angles. And then here you go to instructions. You choose, for example, you want Celebrace for upper, you don't want Celebrace for lower, for example. But here I want Celebrace for upper and lower. And here I write, we will fix the posterior crossbite with MARPI. Please simulate the maxillary expansion and level and align with class 1 canine. Okay, and then we don't want to do extractions, but you can extract if you want, but I don't want extraction, so I don't do that, non-extraction. And I want to bond upper 7 to 7 and lower 7 to 7. But again, you can choose, like, for example, if you want to do, you don't want to extract like bond lower left 7, you can do that. And then you upload CBCT. This is optional. If you want to, you don't have to, but I have CBCT here, so I'm gonna upload that. And photos, here I choose composite. You can upload the photos individually one by one. If I do that, I have to individually upload them, but I want to upload the composite. So I'm gonna click on this and I'm gonna choose the photos of the patient. And then I'm gonna choose the X-ray. I'm gonna choose the panoramic X-ray. And I'm going to choose the lateral step. These are all optional. You don't have to, but if you want, you can do it. And then here you can choose the ethnicity, race, patient email, patient phone number if you want. And then when you click submit, it takes just a few minutes until the sectioning of teeth happens with AI. So this is what we're going to do. I'm going to hit the submit and then I'm going to pause the video and we're going to come back and we'll see how long it took until the sectioning happened. So right now is 3:13. I'm going to hit submit. And as you see, creating new patient profile, it's happening right now. And I'm going to be back after this patient is sectioned. Here you see the button is grayed out and it's not active yet. It means that the teeth and bones and airway, they're not sectioned yet, so you cannot see it yet. Hello, I'm back. Actually, I was supposed to come back in just a couple of minutes, but it took much longer. I got distracted with some some tasks that I had to do. But anyways, here you see that the view TP is not grayed out anymore. I don't know how many minutes passed that the sectioning happened, but this button shows that the sectioning is done. So now if I click on view TP, which means view treatment plan, I can look at the teeth sectioned bone, and sectioned airway. So usually I go to the consult room with this. So I talk to the patients, how the teeth look. I talk about their malocclusion. Like for example, here they have posterior crossbite. This canine is hypocal. This lateral is in crossbite, and also I have the records here, so I can talk over the panoramic X-ray, cephalometric X-ray, the photos, all of that. And maybe I go over the software very quickly. Here I can turn on and turn off the gums. I can turn on and turn off the maxilla. I can turn off the mandible, and here you can see the airway too if you want. You can look at this in different angles. You know, these buttons, very straightforward, and buttons, how you look at the different angles. Here you can measure the distance between the teeth. For example, here is 17.34 millimeters. Here is the grid if you need it. Another interesting option here is I can extract. Here upper left 4 was extracted. Now I want to extract lower left 4. You see it's extracted. So, but I don't want any extractions, so I'm gonna put them back on. Here you can choose what teeth should be bonded, and here is the Bolton discrepancy. Here Bolton discrepancy is already automatically done. For anterior Bolton discrepancy, we have 0.22 millimeters of mandibular tooth excess, and overall 6 to 6 Bolton discrepancy shows that we have 2.71 millimeter of maxillary tooth excess. So in general, it's very simple, and it's easy to work with. And yeah, that was it. So thank you very much for watching this video, and have a great day.